Hi, I'm James Chau, host of the China Current, and in New York for the UN General Assembly. I'm moderating a couple of events here. One of them is the launch of the Global Preparedness Monitoring Board, and it does exactly that, an independent body to track health emergencies before they happen, but also to tell global leaders what they need to do to get ahead of that game. It's going to save money, it's going to save lives, and it's headed by two very special people with a great collection of minds around them. Those two people are Gro Harlem Brundtland, former Director General of the World Health Organization, and El Haj Assi, Secretary General of the International Federation of Red Cross and Red Crescent Societies. The board they lead was set up in response to the 2014 Ebola epidemic in West Africa that centered on three countries, Guinea, Liberia, and Sierra Leone, that killed over 11,000 people. But of course, disease outbreaks have long shaped human history, including the 1918 Spanish flu that infected 500 million people globally and may have claimed up to 100 million lives. These two major events show us that the next health emergency is already on the way. China knows better than most what this means. In 2002, I was starting out in journalism in Hong Kong when I saw for myself the earliest stages of SARS, the viral respiratory disease that was traced back to Yunnan province. It had a devastating impact on the global economy, with losses of over $40 billion, and created widespread fear. Early inaction by China triggered a breakdown in trust, but eventually China opened up, shared data, and collaborated with the international community. This was a turning point for China, not only in its SARS response, but also in the way it overhauled its approach to all health. It began an ambitious program to improve detection of new threats, bolster its response capacity, and report more transparently. And there were other improvements. The number of influenza surveillance laboratories grew to more than 400. The China Center for Disease Control was strengthened. Research partnerships with the World Health Organization were established, and mechanisms for rapid reporting to WHO were put in place. The Belt and Road Initiative, which guides much of China's global engagement today, is creating an even more connected world. But the flip side to that is accelerated movement of disease. This is a dangerous reality for everyone. When the Ebola outbreak hit West Africa in 2014, the Chinese government's response was swift and proactive. It marked the first time China extended massive humanitarian aid to countries in a public health crisis, and it also saw scientists and health workers from China and the United States working side by side for the good of the world. Collaboration is key to a safer global future, and nowhere is this more relevant than between two countries that have the best chance to reshape our opportunities. With increasing trade, travel, population density, migration, deforestation, climate change, global warming, and natural disasters, a new era in the risk of epidemics has begun. We can't afford to wait. There will be another pandemic, but will we be ready? This is James Chau for the China Current. We've got lots more videos, so like, follow, and subscribe at the China Current.